This is a reality we usually face when dealing with IEPs. It is that they are usually exported from specific softwares that sometimes cause the structure of the final document to be a little messy because we have nested tables, fixed position sections, repeated headings, blocks, and many other features that really make the export of the final translation quite difficult. So in those cases, again, I suggest trying both conversion settings to see which one applies better to your specific document. In case you face issues that we usually face when dealing with software, with technology, there are some troubleshooting fixes or some troubleshooting advice I can give you to better deal with those problems. Sometimes you may get an error from Word when trying to open the translated file. So the suggestions here are try to, again, translate the document using a different setting. If possible, go back to the original editable file, or even try to open the doc file in repair mode. Um, if one, as I said, if one conversion pass has issues, try a different one. Another issue we may face is that RTL languages may display incorrectly. So the translation, the content may be correct, but visually it does not look as an RTL language document. In those cases, you will have to check that, and you can easily modify that by simply selecting the whole text and changing the alignment. As you can see, with just 2 clicks, selecting the whole text and clicking on alignment change, I improved the visualization of my document, in this case, translated into Arabic. Something else that may happen is that some text may be missing, repeated, or oddly split, all of that due to the structure of the original document. So it is always important to check headers, breaks, labels, etc., page by page to avoid those errors to be transmitted or given to the final document. Remember that we are working with AI, with technology, and a human eye, a human participation is always necessary to get a perfect or an almost perfect final result.